Hi, ADN students. So what I'm going to do in this one is I wanted to go over a couple of the questions that were most commonly missed on the neuro quiz yesterday. For the most part, you guys pretty well scored the same, which means either A, you guys didn't understand the two questions, or you guys are sharing your answers. So, guys, that's not the point of online learning. The point of online learning is that you work on your own. Um, and that you guys actually learn the content because it actually is important that you guys learn this stuff. Okay, if it was just that you guys didn't understand the question or you guys misunderstood it, let's go ahead and clear that up. Okay, so this is actually how I look at questions to give you an idea of this gives me an idea of how you guys answered. So this was one of the most commonly missed questions on the quiz. It was talking about on the physical exam, a 1-month-old infant, the dimple with the tuft of hair. Okay, the tuft of hair is very specific here when you're looking at spina bifida. This is the occult one. Okay, this is the one that's hidden. So with these kids, most of the time they do not have physical delays here. Okay, when you start looking at the meningocele and the myelomeningocele, that's where you start having the paralysis, the bowel and bladder control issues. Okay, so for the spina bifida occulta, the tuft of hair, usually they're not going to have any physical delays. Okay, so that was one that was commonly missed. Another one that was commonly missed was the febrile seizure. Okay, so if you're looking at this 18-month-old with a seizure, 104 temperature. Okay, you got to get that temperature down because the thing that brings on a febrile seizure, and it's not, there's no number that makes it a febrile seizure. It's how fast that fever rises is what causes a febrile seizure. So if you're looking at these four answers, the only one that makes sense is the antipyretic. We don't give Dilantin for febrile seizures, and I want to tell you guys something about seizures. When somebody is actively having a seizure, the benzo is given to stop the seizure. But in a febrile seizure, we don't always do that. Okay. Phenytoin, your anti-epileptic drugs, those are to help with the seizure threshold. Okay. So make sure you guys understand the difference. If you have someone actively seizing, you don't give them a dose of Dilantin. You give them a dose of benzo to stop the seizure, and then you give them the anti-seizure medication after the seizure is stopped to help with the threshold so that they don't have another seizure. Okay, I hope that makes a little bit more sense. And then the other one, I think this was the other one that people had issues with was hydrocephalus. Um, what you're going to do, and I think what you guys got messed up here is you probably misread the word preoperatively. Preoperatively, we're repositioning this infant frequently because of the excess fluid. It puts them at risk for skin breakdown. Okay. Now, if I had put postoperatively here, then we're looking at blood pressure a little bit more frequently. But again, you're still repositioning these infants because postoperatively they would have that shunned. Okay. So I just want to make sure I went over a couple of these for you guys so that you understood which ones were missed. All right. While I'm switching screens here, I just want to remind you guys that please don't forget to take your quizzes. Quizzes are 20% of your grade. So if you're forgetting to take the quizzes, it's really going to make you take a hit and possibly even not pass pediatrics because 20% of your grade is still 20% of your grade. Okay, so guys, please remember to take your quizzes so that I don't have to log zeros for you. Okay, let's do the breakdown for exam 3. Okay, exam 3 will be on Monday, April 20th. And there's only 3 body systems, so you've got respiratory, cardio, and neuro. So for the respiratory chapter, there will be a question on anatomic differences, okay, which I gave you guys a handout here, so something will be coming off that handout. I've got question about the neonate respiratory system. I have an assessment question. I have another question where I'm going to give you 4 patients, and you're going to tell me which one you would go assess first. I have 2 questions on croup, 2 questions on otitis media, 1 question on an upper respiratory infection, 2 questions on tonsillitis, a question on strep, 2 questions on epiglottitis, a question on bronchiolitis, RSV, a question on suctioning. I have 2 questions on asthma. And if you guys remember, I put cystic fibrosis into this test. So I'm giving you 3 questions on cystic fibrosis. Okay. For the cardio section, you'll have a question on fetal circulation. So keep in mind, these kiddos have a very, very different fetal circulation. And that's where these cardiac defects arise, is from, failure to close. Okay. So make sure you're looking at fetal circulation. There will be 2 assessment questions. I have a question on heart failure. I have a DIG administration question that will be a select all that apply. I have 2 questions on cardiac cath. I have a question on cardiac surgery post-op teaching. And I go with those questions because your ATI loves to ask you questions on cardiac cath specifically and cardiac surgery. So make sure you guys go over those. I have 3 questions on the cardiac defects. I have 2 questions on rheumatic fever and 2 questions on Kawasaki's. And for the neuro chapter, okay, I have 2 questions on assessment, a question on neural tube defects, 2 questions on hydrocephalus VP shunts. I have 3 questions on meningitis, 2 questions on seizures, and a question on head injury, a question on cerebral palsy, and a question on ICP. Okay, that will be the breakdown for exam 3. Other things I just wanted to quickly go over. I did, listen to all your responses this week. Thank you guys for those of you who reached out to me to let me know how you guys want to finish the semester. I also took into account some of you guys talking about how the tests are going. I have reached out to the faculty and I just want to make sure that we're all consistent on how we're giving our exams. So I'm going to keep the exam as 1 question per page. But I heard you guys in terms of the time it takes to load the questions. So I'm going to add an additional 10 minutes to account for that loading of the questions. The reason why I'm going with 1 question per page, guys, is this is how your ATI is. This is how NCLEX is, okay? Plus, I'm still trying to preserve the integrity of my exams as much as I possibly can. So I get some of you don't like the 1 question per page, but this is how online testing is supposed to go. This is how ATIs are. This is how your NCLEX is. So you need to get in the habit of knowing that you can't go back and change your answers on those exams, okay? So I have built in an extra 10 minutes on this exam. So what it will show up as for testing is you'll get 65 minutes plus a 5-minute window grace period, which is more than enough time to take this exam. Okay. If you guys have any questions, reach out to me. I'll be checking my email like I normally do. And again, exam is on Monday. Talk to you guys soon.